The issue of the question of how much data patients are willing to share is a very interesting question. And I think none of us knows the answer, but we know that it's a complex question and it depends upon the patient, perhaps their illness, their need to have additional help to manage their disease or prevent disease, whether there's family available that can substitute or whether there's family pressure for someone to do that. I've asked a fair number of groups of people how they feel about their medical data and whether they would put their health data on an online repository. And in general, the answers I get are pretty clear. Anyone who has a serious medical illness, I've never had someone with a serious medical illness be concerned about access to their data. If someone is traveling and they end up in a hospital in a different city and they end up in the emergency department, the answer is that they want someone to be able to access their health data. I've never had someone say no. Sure, there are people who feel maybe they don't agree and they don't say anything, but just think about it. It's logical that the more concerned you are about your health, the more you have something unusual or that requires a lot of care, the more that it's possible that an intervention elsewhere could cause you more harm, the more likely you are to realize the cost and benefit and you want your data to be shared. But one never knows. Now, I suppose part of the question that you're asking could it be mandated, could be required that if a patient is to receive a certain type of medical device, a certain type of implantable, that must be shared. Well, there is quite a bit of data sharing that occurs, for example, with pacemakers. Right? The patients are comforted by knowing that the manufacturer maintains a list of the patients and their devices. And when a patient shows up in the hospital with a pacemaker, for example, and if they're not conscious and can't provide us with information, we can take an x-ray, we can learn about that device, we can contact the manufacturer. There are things we could learn about that device fairly quickly. And then there are other ways of interrogating the device electronically to learn more about it. So I don't see a lot of concern when people have serious illnesses. I think there's a lot more concern when we have just a large healthy population and we start to become more intrusive with health monitoring. Time will tell.